Welcome to Fairy Tale Access, where the head fairy's quest is to prove that fairy tales do exist in actual time, rather than once upon a time. Together, we will unravel the heroes, young and old, who turn dreams into reality. These are the people who still believe in happily ever after. The discoveries will bend even our most cynical non-believers into believing in fairy tales. Hi, welcome to Fairy Tale Access. Today I'm with Dr. Poe, who will be joining us for a discussion about healthy connections and navigating social media. So thank you for joining us.
Well, thanks for the opportunity. I'm happy to be here.
Well, Forbes describes your blog, KevinMD.com, as a must-read health blog. So can you tell us a little bit about your background and how you developed this particular blog?
Sure. I've been practicing internal medicine for about 10 years now, and I started my blog, KevinMD, back in 2004, and that's almost 10 years' time. And back in the mid-2000s, not very many people had blogs, let alone doctors and other health professionals having blog, and I really didn't expect much from it. But then I started writing pieces and giving my thoughts on their healthcare system, giving my take on breaking health news. And I found that it was a valuable way for physicians to have a voice online. And I think that's tremendously important because, as you know, more patients are online and are researching their own health, they're researching health information. And it is important for doctors to have that type of online presence. And I found that a blog was a valuable way to get that presence and to be heard online. And as you know, social media has so many different tools where we can connect with patients, and my blog was the start of that.
Well, how have things changed since 2004? And what would a doctor put online? What would be important to put online to describe himself and his practice, describe maybe papers that he's written,
Sure.
More in layman's terms?
Sure. Well, I think that since 2004, social media has evolved. It seems like every month there's a new social media platform. When I started, MySpace was still very popular. Now that's replaced by Facebook, and now we have Twitter and LinkedIn and Pinterest and a lot of different social media tools. And I think that gives us a lot of flexibility to connect with patients, because since 2004, more patients are also going online as well. Over 70% of patients, they're going online to research their health. It's the third most popular activity on the internet after email and using a search engine. And I think that's a blessing and a curse. The blessing is that patients are more empowered than ever. They're going into their doctor's office more informed. But the curse is that, as you know, there's a lot of bad information online, information from companies trying to sell products, information by people trying to push their own agendas. So they need to separate what's accurate health information, what's not. And I think that with doctors being online, that's one of the most powerful things that we can do, is helping to guide patients to reputable sources of health information. We need to separate what's true and what's not. We need to interpret the breaking health news and give it perspective for patients and explain what it means to them. And since 2004, we just have so many different opportunities other than blogs to do that. And it's still evolving as we speak.
So in the office, do you find that your patients are coming in, I think I have this disease. No, I know I have this disease. Or, you know what? I saw everything about this drug, and I think this drug is really the drug that I need to take. Can you give me a prescription? Does that happen a lot, or?
I think in general, patients have almost as much access as we do to health information, whether it's drugs from they see on television or through commercials or just from the internet itself. And you have the proverbial patient coming in with a stack full of papers printed out from the internet. And back, I would say about 3 to 5 years ago, doctors would be petrified of that, and that was the last thing they would want to see. But now it's almost expected, and now instead of carrying the stacks of internet papers, they'll just bring out their tablets and iPhones and show me in the office, like, this is what I read on the internet. And I do encourage that, and I think that a growing minority of doctors are encouraging that, because patients are going to do that anyway. They're going to become empowered and research their own information. And I think that we need to, as physicians, we need to redefine ourselves and stop seeing ourselves as a traditional paternalistic physician where what the doctor says goes. I think the medical model for the future is more like a partnership where where doctors can see themselves as expert partners and help guide patients through the information that they all have access to today.
So do you think it's because that you have this particular viewpoint and understand the need? Because you're pretty young, so you said you've been practicing for 10 years, so
Yes.
You've been practicing for 10 years since you left residency.
Mm-hmm.
So you are young, so you're involved in the media,
Sure.
the social media, and you understand how it works. How do you get an older doctor to understand that this is what his patients are looking at, or her patients?
Sure. No, I certainly admit there's a generational gap, and whenever I talk to other doctors specific about social media, they want to practice the way that they've always practiced, whereas doctors say it goes. It's again that paternalistic model, and I think there's certainly a different viewpoint when you compare the older doctor versus the up-and-coming doctor. The up-and-coming doctor who's grown up on Facebook, they're used to sharing, and they're certainly accustomed to other patients as having as much access as possible, almost as much as they do to health information. And I admit it is a slow process, which is why I say it is a growing minority, but it's still a minority of doctors who sees it that way. But I think that it is encouraging because I talk to medical students, and they're certainly viewing the doctor-patient relationship more as that partnership where the patients are empowered, and the ultimate decision certainly is up to them, and doctors are valuable in sharing that decision and help guiding them through all those resources. But I certainly do admit that it is a challenge.
All right, so on your blog, you also co-authored a book called Establishing, Managing, and Protecting Your Online Reputation. It's a social media guide for physicians and medical practices. So in that guide and your blog itself, how can both doctors and lay people use your blog to their benefit?
Sure. Well, speaking from a physician standpoint, I touched earlier upon how important it is for doctors to guide patients through the maze of medical information out there. I think a second way doctors can connect with patients is by giving physicians a voice, because as we know, we're in the midst of healthcare reform. Over the past 5 years, there's been a pretty intense debate nationwide as to the direction of our healthcare system, and the Affordable Care Act, as you know, is very, very polarizing and controversial. And I think that a lot of the decisions in the Affordable Care Act are made by politicians and health policy experts, and they're not necessarily in the exam room seeing patients. And during this entire debate, I think it's tremendously important for physicians to have a voice as well, because they're the ones that are in the exam room. They're the ones facing patients, and they should certainly have a say in the direction of a healthcare system, and sometimes that's lacking. So one of the other ways that I use social media is to give physicians that voice. I don't only author pieces, but I invite others in the medical community, mostly physicians, but also patients and nurses as well, because they need to have their voices heard as well. And by using that platform, hopefully that can also make a small difference and let the decision makers know that, hey, this is what it's like on the ground. This is some of the difficulties that we face. And sometimes a social media platform can connect us to a bigger platform like mainstream media. I've had the opportunity to write for USA Today and CNN and New York Times, and these are mainstream media opportunities I wouldn't have had if it wasn't for my social media platform, because in my training, I didn't have any media training. I didn't write for newspapers in the past, but these are opportunities that I got because of my blog, and it's been tremendously gratifying that I've gotten my voice out there, and hopefully I made a little bit of a difference.
Absolutely. I found your blog personally because I was working on a legal research project. So it gave some great connections, and you have a lot of different writers. So how do you get the different writers to contribute to your blog? Or do they contribute to your blog, or do you ask them to borrow pieces?
Sure, it's a little bit of both.
Okay.
When it was first starting out, when the blog wasn't as well known, then I would invite and solicit the doctors, because I think the doctor blogosphere is very fragmented, and who has time to read hundreds of physician blogs? So sometimes they would contribute a piece, but most of the times I ask them, would you be interested in contributing to a group blog where the voices of physicians can be heard? But as the blog's popularity grew and readership grew, it's becoming a bigger platform. So now that I actually have more pieces than I know what to do with, and I'll get hundreds of submissions every few days, and reading through them and editing them and choosing which ones to pick sometimes can be a challenge, because there are so many stories, so many great pieces that deserve to be heard, but unfortunately I only could pick a few. So in terms of the content, I would say the majority are contributed by healthcare professionals on their own volition, but I do have a core group that I turn to, and they're provocative voices that I do publish on my own site.
Okay, so that core group, are health professionals and experienced in their fields. What about the contributions? How do you verify that they're actually a doctor?
Sure. Well, I could say that the majority of them, they blog under their real name. It's something I certainly do encourage. And sometimes I'll just Google their real name to see if they actually are doctors and they actually practice. There are some physicians that are still uncomfortable using their real name in social media, so they want to go under a pseudonym. And sometimes I'll read that, and you're right, there's no way to truly verify it. A lot of them, I do know their identities, but a minority I will publish under a pseudonym or anonymous, because sometimes some of the things they talk about are pretty sensitive. But I think that, again, it allows a certain freedom in a way that they can tell their story without revealing their true identity. It gives a more honest account. And that's really one of the goals I have, is really to tell stories from behind the scenes and let the public know some of the difficulties the medical profession faces when we try to give patients the best care we possibly can. And I think that that's certainly one of the big successes, is that I get response from patients saying that, Kevin, I didn't know doctors had to deal with this. I didn't know that you had so much paperwork to do, and now I know why we have to wait in the waiting room so much. There's like so much that goes on behind the scenes, and these are the stories that I think are pretty compelling to the public to hear.
And actually, I think that it really humanizes the doctor, so that you understand that they can make mistakes for the patient reader. But for the doctor, I also saw some great articles about ways to just deflect going to court over issues and apologizing to a patient when they find out that something went wrong in their procedure, and letting them know ahead of time. Do you find that type of advice is helping the industry to avoid lawsuits, so that we can have healthy, affordable health care at some point?
I think that it's been tremendously helpful. I think one of the benefits of social media is that the medium itself, it is so transparent. And I think that that's one of the best ways that we can utilize that medium, is to increase that transparency. Let me tell you the story of Paul Levy. Paul Levy is the former CEO of Beth Israel Deaconess Hospital. And when he was CEO, he actually was one of the few hospital CEOs that had a blog. And on his blog, he wouldn't just talk about typical boilerplate PR stuff. He would talk about issues that most CEOs won't talk about, like the infection rates in his intensive care unit, and he would talk about mistakes that his doctors made. And a couple years ago, he famously told a story of a doctor at his hospital who unfortunately operated on the wrong side. And when that happens, normally people would kind of shove it under the rug and keep it quiet. But he actively blogged about it in the open and really told the repercussions about what happened. He educated his hospital staff, and I think the reason he was so transparent is that he wanted others to learn from it as well, so they wouldn't make the same mistake. And I think that using social media in this novel way to really use that transparency to his benefit, I think, can certainly improve patient safety. It could certainly decrease malpractice, because I think that the whole system needs to be less antagonistic, and we need a more open process, and we need to talk about it. And by talking about it, hopefully these mistakes won't be repeated and can impact malpractice in the future.
Great. How about with just the doctor's insurance policies that they have to get nowadays? Does it help with that if they're more open with patients, do you think?
Well, I'm not an insurance carrier, so it's difficult to comment on that. But I know that there are several initiatives, specifically in Michigan, where they encourage doctors and hospitals to apologize. I know there are apologies measures in Massachusetts, and I think that absolutely the medical profession needs to apologize whenever a medical mistake is made, and that apology should not be used against them in any future court proceedings. So it's that type of openness that needs to happen, specifically when it comes to malpractice. Because if doctors are worried about bringing to court, going to court whenever a mistake has happened, if whatever they say is going to be used against them later on, I think it's very hard to have that dialogue to improve. Because if there's constantly a threat of going to the lawsuit, which is a miserable experience for everybody involved, then that lack of openness, I think, is going to be a detriment when it comes to preventing mistakes, because they're not going to learn from it.
Right, and if they're stuck in litigation, that can't help their practice or the other patients that they're dealing with, because it's stressful for everybody.
No, absolutely. And a typical lawsuit lasts 3 to 5 years, and not
it's
only
even longer in New Hampshire, because you have to go before a board before you can actually sue somebody anyway.
Sure. And not only is it stressful for the doctor, but of course stressful for the patient as well. And they have to wait 3 to 5 years before any judgment. So if there's any way that we can simplify and speed up the process by making it more open, I would definitely support that.
I think making it more open, apologizing, and using the money that they would have used in litigation to come to a settlement sooner. Like, how can I write this for you, before I spend thousands on an attorney? Because none of the cases are inexpensive. Mm-hmm. So I think that the apology would be great. Is that not something that they have in New Hampshire?
Not that I'm aware. I know that last year they recently passed an early settlement offer where potential malpractice cases can avoid courtroom by an early settlement. And how far that's actually gone, I can't comment on that yet. I don't quite know the nuts and bolts of where that is. But I certainly think that staying out of the courtroom really is the best for all parties involved.
Absolutely. So what if your doctor tells you not to look up your health on the internet? What should you do? Switch doctors? Try to make them understand? Yeah,
and there are some of my colleagues, unfortunately, that would tell patients, don't go on the internet, and what I say goes, don't listen to anyone on the internet. Well, unfortunately, I don't think that's going to be realistic, because everyone, for pretty much any other field, you think about movies, television, books, and travel, you go to the internet to research the best prices, to research what the best hotels are, to research your books, to read all the reviews. And it's just simply not realistic for patients not go to the internet to look for their health information. So if a doctor told me not to go to the internet, I certainly would consider to see whether that's to see if another doctor would be a better match for you. Of course, there are some patients who prefer the traditional method, and I don't want to mistake that all patients should just be empowered and go to the internet and research their condition, but there will be some who prefer the traditional paternalistic ways, and I think for those that doctor would be a good match. But for others who do want to research and become more empowered, I probably would find a doctor who would be a better match for them. Right,
because I think especially for women with things polycystic ovarian syndrome or other diseases along those lines, where it's something that you're either born with or could have had for a long period of time, and there's only certain standards that all the doctors use. So looking online to see what new treatment options are available, wouldn't that be helpful to bring into the doctor and say, but look, they're trying this?
Oh, absolutely, absolutely. And sometimes when patients have a disease that they've lived their whole life with, a lot of times they're going to know more about it than the doctor. They get a doctor, although they studied it, and they don't have it themselves. And you don't know a disease unless you have it yourself. So I do agree that when they bring it up in the doctor's office, I think that can be tremendously helpful.
Okay, and should patients email their doctors?
Well, I wish all the doctors would accept emails. I think that you look at any other field, electronic communications is the way to go. You can email your banker, you could email your travel agent in pretty much any field. In fact, I can't think of any field other than healthcare where you can't always email your doctor.
And do you think it's because of the HIPAA Act, maybe?
Well, there's a couple of reasons.
Okay.
I think that if you look at the latest statistics, that about 20% of practices allow unfettered email between doctors and patients. And I think there are a couple of reasons for that. Something like a Gmail, Yahoo, or Outlook Mail apparently it's not, doesn't meet HIPAA guidelines, privacy guidelines. It's not secure enough because typical transactions between doctor and patient needs to have a certain encryption, and doctors need to verify that the person on the other end is really the patient rather than someone else. And I think there are good reasons for that. But, and I think the best way to mitigate that is what's called patient portals. And a lot of practices have patient portals where a patient would sign in order to receive and send communication to their doctor. Another reason is that a lot of physician practices just aren't set up yet to receive electronic communications. I think a lot of them are still transitioning from paper to electronic records, believe it or not. And the number of doctors who have electronic records, it's about 60 to 70%. So we're not quite at 100% level. So they're just worried about going to electronic medical records. But I think once they have that, they're going to work on better communicating electronically with patients.
Now, is that an expensive extra system for the doctor to get for email?
I think it depends on the system. I think that there are a variety of options that are out there, and that there are a variety of ranges in terms of how much that would cost. I think another thing that needs to happen is that the healthcare system in general, it needs to encourage communication between doctor and patient, because the majority of the way doctors are paid is really for face-to-face office visits, and doctors generally don't get paid to email the patient. They don't get paid to call them up, which is why a lot of doctors don't call up patients or don't email patients. But hopefully going forward with the various measures in the Affordable Care Act, that's going to help better emphasize communication, and it's going to help stress that. And hopefully in the next 5 to 10 years, we don't have to rely so much on a face-to-face office visit when we can expect, hopefully, more healthcare providers to communicate with their patients electronically.
What about Twitter and Facebook for doctors or patients to contact them that way?
Yeah.
How do you think that might help or not?
I think it does help. I think social media in general, my philosophy is that it's a great way to speak to patients collectively, but not individually. So I don't advise any doctor or health professional to respond or give medical advice to patients on Twitter or Facebook. First off, you don't know who that person is on the other side, whether it's really a patient or not, and you really can't diagnose someone. I remember there was a time I talked to one of my physician colleagues, and someone on Twitter said, "I'm having chest pain, what should I do?" And really, that's not the forum for something like that. Right. I do think Facebook and Twitter is great to, again, talk to patients collectively. You could send interesting health links to patients whenever there's some breaking news. Last week, Angelina Jolie wrote that New York Times op-ed about her mastectomy, and I think there's a lot of physician perspectives when it came down to that, and you could find a lot of that physician perspective by following some links on Facebook and Twitter.
What was the perspective? Because wasn't that an unneeded procedure?
No, I think
at the time,
in her case, I think,
right.
Because I think the thing with Angelina Jolie is she had the BRCA gene, and I think her case applies to maybe 1% of the population. So in her specific case, the double mastectomy was the right thing for her, and I think it was a very courageous piece to really bring that in the open. And as a celebrity, I think that they do hold a special place in terms of talking about health issues in the open, because obviously people would listen to that and look at the conversations that's generated.
Right.
But I think there's a lot of nuance underneath that doctors are saying that, hey, this only applies to a specialized segment of the population. You don't want to be scaring women that they need to get double mastectomies because it is such a specialized situation. So I think that a lot of the physician perspective brought a lot of added nuance to it, which is needed, because whenever health stories are reported, sometimes that nuance is missing. And I think by sometimes following social media on Twitter and Facebook, if you follow some respected physicians, they can lead you to some of the more nuanced take to whatever breaking health stories out there.
Right, and they can ask other questions.
Absolutely. And
that maybe were unanswered in the interview.
Absolutely, because health, 24-hour news cycle, these stories are passed down, and in 24 hours they're lost from memory. And sometimes in that news cycle, it just doesn't have the necessary physician context, and I think social media can help flesh that out. Now,
with Facebook, wouldn't that make them more approachable too?
Well, when it comes to Facebook, I think Facebook is a little bit tricky because a lot of people post personal medical information, information on Facebook. I know on my own Facebook page, I have pictures of my kids, what I did on vacation, what I do after hours, and I advise
maybe one for your friends and one for work.
Exactly, which is exactly what I advise. Because a lot of doctors, they don't have that separation between the personal and professional presence. So yes, you still can have that personal Facebook profile, but you have to close it to the public. And I don't advise any doctor friending their patients. But then they could have a separate Facebook page, which is open to the public. And I think it is a tremendously valuable tool to use that page to connect with the millions of people who get health information on Facebook. So in terms of answering that, yes, it does make it more approachable, but doctors just have to be careful. You don't want to be sharing your personal Facebook profile with them and necessarily sharing, what you do, pictures, vacation pictures with your patients, because I think it does blur that line between your professional and your personal online presences.
Okay. And what other information would be good for our audience as far as navigating between all these social media sources and getting their information online?
Sure. So I think one of the things that patients face is they're just overwhelmed with the amount of information that's out there. You have social media, you have all these websites, and now you have mobile and health apps that people are getting on their phone. And I think one of the ways that physicians can redefine themselves in this social media mobile area is to be curators of that information and to be filters, because if this type of information, if it can't be filtered, we risk us overwhelming patients with pretty much meaningless information. So I always advise patients to ask their doctors, bring up these issues in the exam room. Hey, I saw this study this morning. What do you think about that? I heard this drug just came out. What's your take on that? And I do encourage patients to speak up in the office and talk about some of these breaking health news and stories that are out there, because the potential for confusion is just so vast. Let me bring up the issue of cancer screening, for instance, because over the past few years, there have been changes in the way we screen for breast cancer and prostate cancer. And over the past years, I get questions from women, 40-year-old women asking me whether they should get mammograms or not, or from men, older men, looking for their blood drawn for their PSA test. And they're asking me, should I be getting these? Because these guidelines, they keep changing. So one of the ways I use my own blog, for instance, is to invite cancer screening experts to talk about not only these issues, but some of the issues that aren't often reported, the implications of a false positive cancer screening test, because this is the type of information that patients need in order to make that informed cancer screening decision. So one of the ways social media is so great is that it just allows that doctor to share that perspective and hopefully give meaning to the stories that patients are reading in the media. And I think that social media is a powerful way to do that.
And where do you see the social media growing in the next 5 to 10 years?
Yeah. I think that the health community, the health professional whole needs to accept that we need to be more transparent. We need to use these communication tools to patients. There was a marketing survey, it was a couple of years ago, and it said something like 60% of patients expected their hospital to respond to their concerns electronically within 48 hours. Now tell me, which hospital, realistic, is going to respond electronically to patients' concerns within 48 hours? I think healthcare is really behind any other industry when it comes to communication between doctors, electronic communication between doctors and patients. So I think the healthcare industry as a whole, we need to better adopt these social tools. Right now, things like privacy laws and the fact that communication isn't encouraged, I think that's holding us back. I think that when I talk to a lot of doctors, they're a little bit petrified in terms of how they can use Facebook and Twitter. They're not quite sure how to use these tools. But soon enough, patients are going to come to expect that type of instant communication with their doctors, with their hospital. And it's up to us to really adopt that going forward. Because if not, patients are going to go elsewhere. And I think that's one of the risks that we face. Because whenever patients are going online to research their health information, let's take a look at vaccines, for instance. And, there's a lot of false information online about vaccines and the false connection between vaccines and autism. And I think that if we don't have a role online, if we can't connect these patients, they're going to go elsewhere for health information. And we're going to lose our standing as healthcare authorities online. And that's a danger that we face if we don't readily adopt these tools.
Right, because I guess it wouldn't be against a HIPAA violation if a parent wrote to you and said, I'm bringing in my child for immunizations, but I found this, and this online about it. Could you then, I think the physician could send an email back and say, well, I understand your concern, but these are more reliable sources, and this is what they're saying.
Yeah.
And give them that. That way, when they come to the office, they feel better informed about their decision. It doesn't waste as much time in the office. Yeah. And it gives them more reliable sources because it's a source that you trust.
Absolutely. And
if you communicate with people, I think they trust you more. And it's hard to find reliable sources on the internet. No, just because it has MD in it or it's .org, it doesn't mean it's a nonprofit. It doesn't mean that it's safe.
Absolutely. There's just so much that's out there that's confusing. I think in general, .gov, governmental-based websites, some .orgs are good, but I would take those over a .com. Whenever a healthcare consumer or patient is looking at a site, you always have to know who's funding it, look at the advertisements on the site, and look at the writer, if the writer has any connections with the advertisers. And I think those are the critical things that any healthcare consumer needs to look at whenever they're online and researching health information.
How do you recommend patients find a doctor online?
Well, I think
because I think that's the first place most look nowadays.
Well, when it comes to looking for a doctor, I always use the paradigm as the partnership. And like any partnership, there's going to be good matches and not so good matches. A doctor may be great for one patient, but may not be good for another patient. And I think as a patient, they need to think to themselves, what do I need to look for in a doctor? What's important to me? What do I value? Do I value a doctor who wants to be on time? Do I value a doctor who wants to spend as much time with me, but sometimes may run a little bit late? Does that doctor go to a specific hospital that I'm interested at? Does this doctor refer to a certain group of specialists that I'm interested at? And I think that these are questions that patients need to ask themselves before they go to a doctor because they need to know what they value. I think at the very least, they need to know whether a doctor is board certified or not, because there have been studies that connect board certification with better quality care. And they can go to the appropriate specialty society online to research that. I think it's important to know whether a doctor has any malpractice cases against him, and that's, you can go to the state medical society to look that information up.
Now, does every state have those malpractice suits available?
I think it's variable. It's variable. I think I would start at the state medical society, and in terms of getting that information, it's variable by state. And I think when it comes to researching your doctor, I think there's kind of good and bad news. The good news is that patients have so many different sources that they can look up information about their doctor. But I think the bad news is that I wouldn't rely on one single source. I always see it as a puzzle. I think that these pieces are complementary, and we're talking about word of mouth, the newspaper, hospital, and of course going online. And I think that when patients start their search for a doctor, they shouldn't rely on just on one source. They've got to use all these pieces. I think that Googling their doctor is a good idea. I think talking to their friends and talking to other members of the community is a great idea. I think talking to the hospital is a great idea. And at the end, even calling the office itself and maybe requesting an initial interview, a meet and greet with the doctor to make sure that the personalities mesh, to make sure that the philosophies mesh. I think that's helpful as well. I think the bottom line is that these pieces are all complementary, and you have to use all of them together to choose the right physician for you.
What about physician rating sites like RateMD's, Vitals, Healthgrades?
Yeah. Well, they've certainly proliferated over the years because patients now, they want ratings on everything. Everything's rated. You go to Amazon.com. I go to Amazon. I buy a lot of things there, not only because of the variety, but also I like to read what other people say about them. I go to TripAdvisor because I want to research hotels and I want to see what other people say about them before I book my stay there. When it comes to rating doctors online, we're not quite there yet, unfortunately. I think we have dozens of rating sites, but the quality of the information there isn't quite where we'd like it at. There was a study earlier this year from, I think, a urology journal that looked at these rating sites and found that for the majority of doctors, they had 0, 1, or 2 reviews. And just like you wouldn't make a hotel booking if only had 1 or 2 reviews, it's hard to choose a doctor if they only had a couple of reviews. And I think that if you go to a site and they had maybe 20 bad reviews, that may be a red flag. But I think in general, the fragmentation of the site prevents them from being truly useful. And like I said, I think it's a small piece in terms of the complete puzzle that the patients can use to choose a doctor. Mm-hmm. Hopefully going forward, these sites will become less fragmented. Hopefully more patients will rate their doctors online. And not only will that be helpful for patients, but I think it's also going to be helpful for physicians as well, because when I read these sites, that patient feedback to me is sometimes beneficial for doctors to improve themselves. And talking about that transparency again, it's right. Important to hear that feedback so we know what to work on. Hopefully in the next 5-10 years that will happen, but as of today, we're not quite there yet in terms of relying on these sites to choose a doctor.
Would it be a good idea in the future for doctors to recommend that they fill out a survey online?
Yeah, I think that's happening now, and that's something I do recommend. Again, there are studies that looked at dozens of these sites, and contrary to a lot of doctors' fears, most of the online reviews are positive. When I talk to other doctors about them, you mentioned online ratings.
Except for surgeons. Sometimes they're never nice, I guess.
Well, that's a whole different topic.
They're great at their jobs, and it's funny.
Well, whenever that comes up, I always ask, would you prefer a surgeon with good bedside manner, but not in the operating room, or the other way around? I think that when you look at the studies that look at these sites, find that most of them, in general, are positive. I think there was one from the journal General Internal Medicine that found that almost 90% of online patient reviews are positive and better than a lot of doctors would think. So there are practices who use this fact to ask patients to rate them online. And they don't just cherry pick the good ones. They ask all their patients to rate them online. And chances are those ratings would be better than a lot of doctors would think and can drown out any negative outlier reviews. And not only that, it will make these ratings more helpful for patients as well, because it's going to increase that database. So yes, I actually do encourage doctors to ask all their patients to rate them online.
No, I think that's a great idea, because like you said, with Amazon, if you're trying a new electronic, you want to know how it works, or what other people have experienced, because sometimes it's just one person that had a bad experience. It could have been a bad day.
Sure. And I just want to interject. I think one of the things also is that when doctors get a bad rating, sometimes it's not the doctor, him or herself. It could be not enough parking. It could be something with the nurses or the medical assistant. It could be the magazines were up to date. But I think all of these factor into the complete patient experience. And sometimes, like for instance, if a patient leaves my exam room, I don't know what they thought about all these things. All I know is that I interacted with them. And sometimes doctors need to hear that, because there's no other avenue for patients to give that feedback.
That's true. So the information online is not always trustworthy then?
I think that goes this in general. Are we talking specifically about physician ratings or just health information in general?
And how should a doctor respond if somebody did say they found something negative online?
Yeah. So I think the first thing I recommend doctors do is simply to listen to them, because a lot of that feedback sometimes they need to hear about. And reading a lot of these reviews, I noticed that sometimes patients are frustrated that they have to wait weeks or they never hear back from the doctor after getting a lab test or an x-ray. And one of the more recent issues I hear about it, that doctors right now with the electronic medical records are too busy, looking at computer screens, too busy looking at laptops rather than looking at patients when they're talking to them. And sometimes they need to hear that. And I read a lot of these reviews, and personally I made changes in my own practice based on this type of feedback. I offer more same-day appointments. I make a concerted effort to give patients a copy of their raw data back whenever they go for a lab test or an x-ray. And I don't even bring a computer in the room anymore, because I want to make a concentrated effort to look at patients in the eye when I'm talking to them. So by reading this type of feedback, even though it's critical, I think it's constructive in a way, because it can help a lot of doctors actually improve their practice and make them become better doctors.
Do you notice a difference in requests between generations of patients? Does the older generation expect something different?
Absolutely. I think that the older generation patients, they prefer the kind of I would say the traditional model. I always say paternalistic, but let's call it the traditional model, where whatever the doctor says goes. And I think that's completely fine. And as a doctor, we need to adjust and do what's best for the patient. But I think the younger ones who are more internet savvy and they come in with that information advice, they come in already knowing what questions to ask. I do think that is certainly generational. And as more of them become our patients, I think that physicians, we need to adjust that paradigm that, hey, these patients are becoming more empowered.
Great. And now what about the book that you co-authored, A Social Media Guide for Physicians and Medical Practices? How did you start that?
Sure. So I've been involved with social media since 2004, and I was approached last year by Nancy Collins over at Green Branch Publishing, asking me and my co-author Susan Gay to write about a book about social media, about how doctors again are petrified about patients Googling them online. And I thought that was a great idea, because on my own blog, I give doctors recommendations on how they can improve their online reputation and let doctors know that, hey, patients are Googling you, and if you don't have an online reputation, what's going to come up? It could be a negative news story, it could be a negative review from one of these online rating sites, and doctors, you need to wake up. You need to control and proactively define yourself online and establish an online reputation. So I thought that was a great opportunity. And I think one of the obstacles I had initially is that I simply just didn't have time to write a book. It's obviously a huge endeavor. I was seeing patients, doing my blog, doing social media, Twitter, and who had time to write a book. But I think that the arrangement that my publisher gave and my co-author helped me a lot. I think the finished product is tremendously helpful for doctors, because it really opens their eyes to this new generation patient. It opens their eyes that patients not only are Googling health information, they're Googling their doctors as well. And more patients are going to be going online to research their physician. And if doctors don't have any online reputation, someone else is going to write something about them anyway, whether they like it or not. So why don't doctors take control of that? And I recommend, I'm drawing from my own social media experience, I recommend that they have a strong social media presence as well. Get a profile on LinkedIn, go to Twitter, go to Facebook, maybe start a blog. Not only is it helpful to connect with patients, but it also builds what's called their digital footprint. So when their names are Googled, it's not a negative review, it's not a bad news story. It would be a LinkedIn profile, which is essentially an online resume. It could be your blog, and the goal is to control that information. You control that information when patients Google that. And I think that that helps an online reputation, because it's not information that others have written about you. It's information that you yourself have written.
Now, what about, we have Angie's List, Craigslist. The Angie's List, I guess, is more about the people that come to your house for maintenance. So shouldn't there be a list like that for doctors? Well,
I think that there are dozens of the Angie's List.
But with more choices, so that you can get a better perspective of what they're talking about. Is it the level of care? Is it the office staff that makes you crazy? Or like you said before, the parking or...
Yeah. Well, Angie's List does have a physician rating service.
Oh, they do?
They specifically. You have to be a paid member to use it. And I know that right now there's a big battle when it comes to online ratings, like who's going to come up, right? It's just so fragmented right now. They're just fighting among themselves to be the physician rating service. In Massachusetts, they have a project spearheaded by Consumer Reports, where they would get 50 to 60,000 surveys of primary care office, and they would marry that with quality measures as well. And I think that would be the ultimate physician rating, when you could have these subjective ratings combined with objective quality measures. And I think that would truly be useful when it comes to patients, because sometimes the doctor may not you brought up the issue of surgeons earlier. Sometimes the doctor may have great bedside manner, but how does he control one's diabetes? Are all his patients' blood pressures controlled? And I think we are very far off from that type of information. And hopefully, again, in the next 5 to 10 years, there'll be a way where we can marry these subjective ratings with more objective clinical measures, and patients can really have that information to make that right choice.
Now, with hospitals, they send out surveys all the time to see what we thought about the care that we served, and they're pretty intense.
Yeah.
Why don't they post those online, even if they're anonymous, so that people know? And
there are hospitals that actually do that, but you're right, they are in the minority. The University of Utah, you're referring to the Press Ganey surveys that patient gets, and they would take that information and using that aggregate data, they would use that to rate their own doctors based on that. And I think that's something that needs to spread. And I think that hospitals right now, in general, they have a lot on their plate, especially with healthcare reform. And I think that this is a fantastic way, and that's an information that they certainly can use to become more transparent.
Wow. So transforming the social media presence into the mainstream media voice, how did that come about?
Well, I think when I was writing my blog, I would talk a lot about our healthcare system. I'll talk about healthcare reform, and journalists always would want a physician's opinion. You know, what do you really think about this? And I would start getting media calls based on some of the articles from my site. And eventually one of those media calls turned out to be an editor from USA Today. And I think I wrote a piece on the primary care shortage and talking about how there's not enough primary care doctors in the United States. And I think one of the editors at USA Today asked me to kind of expand one of my blog posts and write an op-ed on the newspaper. So that's what I did, and I got that opportunity to be published in obviously a newspaper that had millions in circulation. And I think that was the first time I realized that I'm not talking on a small stage, a small social media audience now. I'm talking to the entire nation in a national newspaper. And I think that's when I realized that, hey, we need to make our voices heard, because sometimes these policy experts, the politicians, they just really don't know what it's like to practice medicine. I don't think they appreciate that there's such a primary care shortage.
Right, and I don't think they always understand that, you know, the general public, especially a doctor has a full schedule, can make it to their committee hearings that they only let you know about usually a week or two before.
Sure.
And with the shortage of primary doctors in the United States, do you think that it's in part due to the amount of insurance that they have to purchase and all of the other safeguards that go along with being in practice?
Yeah, I think there are a couple of reasons why there's a lack of primary care doctors. I think if you look at every other country, industrialized country in the world, the ratio of primary care doctors to specialists is about 60-40, 70-30. In the United States, that ratio is reversed. There's 30 to 40% primary care doctors, 60 to 70% specialists. And the reason for that is that specialists, the procedures that they do tend to be reimbursed at a higher rate than when I see seeing a patient for blood pressure, for instance. A 15-minute office visit isn't paid as much as doing a biopsy or a cardiac procedure. And that leads to medical students, they graduate with about $160,000, $170,000 in debt. And when faced with a choice of going into primary care where what they do isn't reimbursed enough versus specialty care where they get paid 2 to 3 times more, I think it's a stark choice for a lot of them. And unfortunately, all the incentives in our health system favors being a specialist versus being a primary care doctor. Now, hopefully with the Affordable Care Act, that's going to change, but it's done irreparable damage to our healthcare system because there's a clear shortage of primary care doctors right now. If you go down and look at our neighbors down to the south in Massachusetts, the wait time to see a primary care doctor is about 30 to 40 days. And they're looked upon as the model for the rest of the country. Already with the primary care shortage, next year there's going to be 32 million newly insured patients. And where are they going to go for healthcare if there's no one to see them? And that always brings me back to the question: what good is health insurance if there isn't a doctor to see you? So I think the primary care shortage needs to be addressed more than it is now. And I think in order for any healthcare reform, whether you support the Affordable Care Act or not, any healthcare reform, I think it needs a strong primary care backbone. And that's an issue that I try to bring up not only my own side, but also with various mainstream media platforms, because it's a message that needs to be heard.
Absolutely. So do you think if the Affordable Care Act actually did something for primary care doctors' education the same way they do with teachers,
Sure.
do you think that would help the industry grow? Maybe if there were more scholarships, or if they paid a certain fee
Sure.
for a number of years and then it was forgiven
Sure.
after 20. Do you think that might,
Yeah,
little things like that would help?
I think it will. I think to the Affordable Care Act's credit, it does do small incremental steps in that direction. For instance, if doctors practice in a underserved area or at a community health center, there are some initiatives that would forgive their medical school loans. I think the issue is that there's just not enough of that, and we need.
So if they had more of that for the primary care doctor, do you think that would help more students pursue that education and stay in that field?
I think it would, and I think the cost of medical education, which is certainly another issue, I think it is when you compare to other countries, like people graduate here with about $150,000, $160,000 in debt, and you compare that with other healthcare systems, say France, for instance, where medical education is government subsidized, so when patients, so they can pretty much choose any field without repercussions of income repercussions of their choice later on. And I think that in the United States, if medical education were subsidized, as well as malpractice insurance, if they were subsidized by the government, I think that's going to free up a lot of students to choose primary care going forward.
Great. And are there groups that are taking part in making sure that that happens in the future?
No, many of the medical societies, specifically the American Academy of Family Physicians, the American College of Physicians, those are specialty societies that really advocate for primary care, and they're doing their best in terms of pushing primary care going forward. But it's a little bit of an uphill battle, because this is an alarm that we've been sounding for almost over a decade now. Wow. And look at where we are now.
Amazing. Well, thank you for all the information. Is there anything that we haven't covered that our audience should know, either from the doctor's perspective or from the patient's perspective, as far as getting their information online, how they interact with their doctors?
No, I think so. We've been pretty comprehensive in terms of covering it. I think my bottom line message is that social media is a great opportunity to make your voice heard. And I've talked about how I've been heard on social media, but I think it's important for patients to make themselves heard on social media as well. And one of the things that I like to talk about is that not only should patients hear what doctors are saying, doctors need to hear what patients are saying as well, because a lot of doctors, they don't have the diseases that, or the conditions that they see in the office. They don't take a lot of the medications that they prescribe, and they don't go through a lot of the tests that they order. And sometimes if they listen to these patient stories on social media, it really gives them a new appreciation. And personally, I've learned a lot from reading a lot of patient blogs and listening to what they have to say. And again, I think that it helps me become a better doctor as well. So hopefully, one of the goals I have with social media is that it brings patients and doctors together. And sometimes I know that they butt heads a lot, and I think that we're all on the same page. And hopefully, using this as a tool to come together, it can ultimately help improve the healthcare system.
Fantastic. Why did you decide to become a primary physician?
I trained at Boston University, and I did my residency at Boston Medical Center. I did internal medicine residency, and I'll be honest, when I started medical school, I didn't have a clear idea of what kind of doctor I wanted to be. I didn't have a clear idea of what our healthcare system was and is, but I realized that in primary care, it's something that, for me, I can make the most impact on patients. I think that in terms of what patients need, especially going forward, they need primary care doctors. And I wanted to go where I was needed.
Wow. Well, your patients must feel very confident in you.
Well, I'd like to hope so.
Well, thank you for sharing so much. And can you tell me what your favorite book of all time is?
I don't know if I have a favorite book of all time. It's like choosing one of my kids. I can give you some favorite authors, perhaps. I like anything by Malcolm Gladwell. I think that he has a great perspective in terms of a counter. I always like going against the grain and going against conventional wisdom, and I find that a lot of his books, Outliers, Blink, Tipping Point, I think those are all fantastic. I enjoy reading Nate Silver a lot. He blogs at a New York Times 538 blog, and he recently wrote a book about essentially filtering all the data out there and using that data to forecast, making sense of the numbers to forecast. And I thought what all his writing is great. And I'll be honest, I don't read as many books as I would like to. A lot of my reading is kind of short form things on blogs, but it is something that hopefully I can get back to.
Great. Well, thank you so much for your time today. I appreciate it.
Oh, thanks for the opportunity.
My pleasure. And until next time, keep asking questions and work with your doctor to find out exactly what's wrong and shift through all the information. Until next time.